I am joined by my friend Richard Scott. Hello, Richard.
Andy, great to be back.
Yes, I'm loving you back on the radio. We've missed you.
Well, yeah, no, it's interesting when you have time away from something. I think, as ever, you appreciate it more when you've been away. You know, whether it's you've lost health or you've lost whatever. And I'd lost time with yourselves on the radio, and yeah, I was enjoying it before, and I'm enjoying it even more now.
Fabulous, because I think we just need to recap this just again. You have been a surgeon, you've been a GP, you recently retired September, quite rightly so, I think. You enjoyed some non-surgery time. I don't know how you want to phrase that.
That's about right. And we had myself and my wife and myself and two friends had a good trot round Scotland, which was stunningly beautiful. And yeah, a good time, not just for rest, but also just to appreciate what God has made. He didn't have to make such a beautiful planet, but he chose to.
Yeah, I have had this chat with Anne Law Jackson talking about nature and sensory health, and the fact that not only did God make it, which blows my mind, it's the fact that he designed ears that could actually not just hear it, but actually the emotions to appreciate what our ears could hear of the sounds that he generated. And it was just, that's quite deep.
But funny enough, he put it all together, and it's for our benefit. And I think we're not grateful enough as Christians, let alone as we're non-believers.
Yeah.
We're not grateful enough for the wonderful planet we have.
Amen to that. Right, now we are going to look at a question that came in that you saying, I don't know, I'll go and find out. So before we get into it, just remind us, what's the topic?
Well, the topic was, and this came up last week, one of your listeners wrote in, does the mother's brain change after delivering a baby? Okay. And then he linked it with further sort of sub-points. Does the brain shrink? And does the grey matter in the brain reduce whilst the white matter increases? And I said, oh, right. Tell you what, I'll look it up. So yeah. I did.
Well, you see, I've learned something already. I didn't know there was grey and white matter. I thought there was just brain.
No.
I'm not medical. Which is why I defer to you. I think we all have thoughts on brains and perhaps cognitive strength following and surrounding a baby birth. I think we all have thoughts on that one, but I'm looking forward to this one.
Well, I was particularly interested. In fact, so interested, I'm going to make it the whole topic tonight rather than just simply answer the question briefly. Not only because I thought it was a very interesting question, not only because I think it's probably a very important question, but also my youngest daughter had a baby last week. And so if and when already she's struggling to sleep, the baby likes to be awake during the night and sleep during the day, all the things that young mums and dads, of course, have to get used to. But what's my brain doing amongst all this? Well, I can tell her now because I've looked it all up. And of course, MRI scanning has made a huge difference here. We don't know, we wouldn't know what's shrunk and what's increased if we didn't have scanners to tell us. So here we go. Until 2002, there was very little research. And at that point, a researcher discovered that, yes, absolutely, the mother's brain overall does shrink. And not just in humans, but they've done some tests in mice as well. Perhaps mothers from the past and maybe mothers at the present will say, well, maybe that aligns with the brain fog, memory loss that people loosely call baby brain. But that's just a sort of very, very sort of broad brush thing. There's been more studies since 2002. And this is really interesting. Not just does the brain change after delivery, but in 2018, the studies show that the brain changes before the baby is born. And in 2024, a study showed that these maternal brain changes don't just happen before the baby is born and say 12 weeks, up to 12 weeks after birth, but can be long lasting. Some studies say 2 years, some studies even up to 6 years post-delivery. So these are long-lasting brain changes. So what happens and why? Well, the brain is divided into grey matter, as we discussed earlier, which are essentially the neurons, the brain cells, and the white matter, which are the axons, the long extensions from the brain cells which connect with other brain cells, the connectivity of the brain, if you like. And the grey cells are responsible for emotions, for memory, for movements, whereas the connections obviously allow the cells to connect with each other, to set things happen in a coordinated fashion. Well, whoever looked this up was absolutely right. Not only does the brain shrink, but the grey matter, the cells shrink in certain areas. So the prefrontal cortex, right at the front of our brains, which is responsible for memories and links into the rest of the frontal cortex, which does movement, and the amygdala, which are responsible for emotions. The thickness of the brain cortex, the brain, by the way, is very convoluted to increase its surface area to allow us to fit in, if you like, more brain cells per surface area. Well, this cortex does indeed reduce, but the white matter increases. So we also get more cerebrospinal fluid and more volume of the ventricles, if you like, the lakes of fluid in the brain. And overall, there are very few parts of the brain which are untouched by pregnancy. This, I think, is exciting because we've talked before about how adult brains, we've come to understand more and more, are not fixed. And the fact that they can change is called plasticity. They're plastic. I think this is important to us as Christians, because people who maybe think they're fixed, this is the way I am as an adult, can be completely overwhelmed by God and change. And undoubtedly, although I haven't got the proof in terms of an MRI scan, I bet you, if I was a betting man, that their brains would change as a result, because God changes every part of our lives. We become new creations, and he will change our brains as well. And he's given us brains that are sufficiently plastic, even as adults, not just as kids, although it is easier to become a Christian, I believe, as a child, hence the numbers. But even as an adult, we can change. Our brains can change given the right stimulus. And obviously pregnancy is the right stimulus for mothers. How does it take place? Well, that was my next question. Okay, so we know that the grey matter reduces, white matter increases. How and why? Well, the fact is, we know that maternal hormones go through the roof. So oxytocin, which is the bonding hormone, prolactin, as you can imagine from the name, enables milk production. And some of the steroid hormones also shoot up during pregnancy. So these hormones not only supply food for the infant, but also allow for attachment behavior, for bonding, oxytocin not least, for bonding between mother and infant. Very important in humans, probably even more important in animals. Why? Well, so that the mother doesn't just not only reject her baby, but actually attack it. Because this baby is threatening her. It's threatening her food supply, it's threatening her time, it's maybe a bit painful. Well, the mother might give it a good clip round the ear and walk off, were it not for the hormonal changes affecting her brain. So I think that's why we're seeing these changes in pregnancies. God has designed us and changed our entire body physiology, the mother's entire body physiology. We know that she gets more anemic during pregnancy, higher blood volume, so many changes. So no big surprise that the most important organ of her body, the brain, also changes profoundly. Now, any downsides? Well, we know that 10 to 20% of women sadly get quite depressed. Can be in pregnancy, but particularly post-delivery, 10 to 20%. Perhaps these changes in the mother's brain make her more susceptible to depression, even occasionally, and I've seen this on certainly 2 occasions in my time, actual maternal psychosis, where the mother becomes dangerous to the baby. That's very rare, fortunately. But perhaps these changes are responsible for that. But very interesting that not only are these changes observed in humans, but in animals. I mentioned mice earlier. Guess what? Dad's brains change as well, although we haven't got as much information as mum. So, dads need to bond with the baby. Well, how's God going to do that? Well, he does it. We do bond with our babies by and large. And there seem to be, although it's much earlier days, because bear in mind the mother studies haven't been going much longer than 20 years. Dad's brains also need to be studied, I believe. But apparently there's some changes in dad's brains as well. So I think I'll leave it there. There's a huge amount. If you go into these studies, my goodness, it's complex, because brains are complex. And, people have done some studies, 20 people here, 100 people there, not enormous numbers, but enough to say, there seem to be consistent brain changes linking in with the obvious hormonal changes that occur during pregnancy. So good question. Very good question. Good learning point. And I think it just once again brings out the fact that God has designed us amazingly. And clearly, this is a massive change, not just for the baby. When a baby is born, wow, that's a huge change. But for the mum and dad, my goodness. I mean, getting married is a big one. Having a baby is much bigger in my experience.
I would say the third one is where everything changes, but that's a whole different conversation. Right. let's just go there. So the depression is one of those classic things we've heard about. We've seen it in films, we've watched it in books, where the mum has a baby, and then some point after having had a child, they come home and then depression sets in. I mean, do we understand any more of that? Because is it? I'm not medical, okay? I'm not medical. Is it as simple as all the hormones like maxing out in all sorts of areas suddenly disappearing? Is it as simple as just the change from so many hormones to much less, because obviously they don't need them now because they're not having a baby, they've had the baby? Is it as simple as that, or is it far more complicated? And forgive my medical lack of brain.
I suspect that's part of it, but some of it is just very simple, I believe, which is that, it's so hard that especially those first few weeks, no sleep, painful nipples, especially sort of day 4 or 5 when the milk comes in, it's just painful, and then you can't sleep, and then the baby cries. Maybe at some stage, not so bad now because husbands often get some paternity leave. I'm pleased to say my Abby's Nick has got 4 weeks paternity leave. We never used to have that. So suddenly the partner's back at work, and it's just, you look forward to this event so much, and the reality is just, it can be shattering at times. So I think there's that. To be fair, some people who get postnatal depression, not all by any means, but some have had an element of depression previously in their lives. So there's perhaps some tendency there, but I believe it's just such a hard process. Yeah, I'm sure hormonal changes are part of it, but it may just be simply, it's just so tough. Throw in the fact that not everybody has the amount of family support. Some families are very good with support. My wife Heather's been in London most days in the last 8 supporting Abby. Not everybody has that level of support in the family. Abby's also got 2 older sisters who can talk her through tough times. That helps. Not everyone's got that. So I think there's a lot of environmental stuff as well as hormonal and perhaps a slight genetic tendency as well.
Okay, it's just one of those things I've always wondered about. Interestingly, although this doesn't surprise me at all, apart from the fact I haven't thought about this, was that men's brains are changing as well when they become dads. Now, I don't find that in any way surprising, other than I'd never have thought about that.
Isn't it interesting? Seeing that, and it was just a small line in one paper, and then there was no further information. So otherwise, I'd pass it across right now.
Yeah.
I'm thinking, yes, but how? Because surely men's hormones don't change. If you scan our brains, would they be different? Well, I look forward to, if I find anything, my goodness, I'll pass it back, because that's really interesting. I think it's probably more important to find out about the mother's brain, but let's find out about the dad's brain as well.
I remember every time we had one of our children, we've had 4, lost 1. I remember being in hospital, and of course the midwives are focused on Jo. She's the mum about to be. But I remember kind of zoning out just a little bit, thinking, I know your focus needs to be on the mum because that's the person that's having a baby. But actually, if you put some attention onto the dad, you might find it's actually like a force multiplier of help and assistance. Because I used to work with midwives just a little bit, doing some breastfeeding talks for new parents to be. So I had a sort of a slightly different perspective, but I remember thinking, yes, we absolutely should care for the mum. They're having a baby, for heaven's sake. They need our care. But actually, I think, it's easy to push the dad away when maybe that actually could create more problems, even short term.
Yes, and dads need support as well, which I think that is important. Great that there is this thing called paternity leave now, which, as I say, in our benighted times in the past didn't exist. I think that's wonderful. And I've got some friends whose children live in Spain. They've just had a baby. Oh my goodness, the Spanish give them such a large amount of maternity and paternity leave. It's astonishing. Wow. Far more than we do in England, because they recognise the importance of a family, the family unit, and the family unit includes the dad as well.
I'll be honest, I'm really fascinated by now why the dad's brain is changing. I'll tell you why.
Look that one up more.
I'll tell you why I go here, because when we were, I was learning more about the like having a baby. You go on these like parent classes, don't you? They teach you about nappies and all sorts of things, and the process of labour and hospital. And you go through these classes, and they're really, really good. I like them. And I got on with one of the midwives quite a lot, and I did a little bit of work, as I say, doing some breastfeeding workshops for new mums. As a stay-at-home dad, how can you use breast milk? Well, that was my little bit of the 3-week session talk. But what strikes me is that let's go to the bonding. I remember saying to the mums, because they had always had the same question. There's like 30 or so mums at a time. How do I know that the dad is going to bond? Which is one of the things you picked up on. And I would always say the same thing. And let's just say I learned to say this differently over time quite quickly, because I would say, don't ever fear. The dad is going to bond. Don't ask me how. I have no clue. I've got a child. I don't know what the thing is. There's no hormonal connection here because, yes, it's my child, but I haven't had the baby. You did that. But don't worry, the dads will always bond. Now, I had to be careful because these are mums who are quite close to giving birth, and then they'd all start to cry. So I had to be quite careful how I spoke because, of course, their hormones are high. I'm saying something really lovely and encouraging and supportive, and they're not getting a 5 out of 10. It's like a 15 out of 10, kind of on the emotional spectrum. So I could very easily see the change in these mums because the fact nothing else, then they are pregnant.
Well, there we are. You've given me a little bit of homework for next time. I'll see if I'll dig deeper into dads' brains and changes, just because I think it's an important topic.
Yeah, I know where it's going to go, but that doesn't matter. I think it's so important to understand some of this stuff because brain fog. I mean, like you said at the start, it's such a colloquial. Oh, it's a bit of brain fog, and it becomes almost an excuse of, oh, it's just brain fog and baby brain, and well, perhaps there's something of that, and we need to be compassionate and understanding. But actually, from a medical point of view, there's got to be. Well, how often do you have the brain fog, and does it actually cause you any physiological issues, or are you burning yourself because you've forgotten to use the kettle properly? And there's going to be a consequence, and it's too easy sometimes. It's just baby brain. Well, actually, it might be more than that.
Mm-hmm. Yeah, but interesting that the grey cells and the cortex does seem to reduce in order that other areas of the brain can increase. So I guess that's maybe a little bit of a price to pay for all the good stuff that we see in pregnancy, and perhaps the mother's attention's on the baby. Perhaps she doesn't need her grey cells to be functioning, quite so sharply, say at work or whatever, and for a time. I'm not saying that baby brain is inevitable, but I think these changes occur for a reason, and you can't have an increase in one area without a little bit of a decrease in another area.
I do think in society, because of the way we think about things now, we like to think, oh, we can affect this. We'll change this. Like when you see, I know it's a silly example, but just go with it a sec. When you see a flood barrier go up, we're going to control the tide. No, you're not. You might influence a ton of it. You're talking about the sea. No, you're not going to control it. You might just control it here, maybe a little bit. But I think we apply the same logic to the body. Oh, well, we can get past this. We'll work harder. We'll take more caffeine. We'll do this. We'll do that. And yeah, but sometimes wouldn't it just be a bit less tiring if we kind of went more flexibly with what was and thought, the mum's probably not going to get dressed like she used to be anymore because, hey, do you know what? She's been up 2 hours and tired. And do you know what? It's okay that your house isn't immaculate because you know what? Nobody cares because you've got a child and that's more important.
Absolutely. Priorities. Absolutely. And common sense, dare I say.
Yeah. It's just one of those. How often do we try and force things to be okay when, do you know what? You've got a baby. It's phenomenal. It's an amazing blessing. It's God's beauty. Just don't worry about the fact you've got the wrong food. It's fine.
Point.
Right. This was fascinating. I thought it might be interesting. I still don't get grey and white brain matter, but that's okay. I'm not a doctor. I'm not about to operate on anyone's brain anytime. Not soon. Anytime. Not squeamish. Just no. My hands aren't that steady. They're not bad, but no. Right. Now, if you've got any questions for Richard or any thoughts on anything we've just talked about, because I found this really interesting about grey matter, white matter, birthing in terms of hormones, mums, brains changing and all that. If you've got any thoughts on that, or if you've got any studies you know of about why dad's brains too, which genuinely fascinated by, then let us know. Email hello@pure247radio.org, hello@pure247radio.org, and we'll do our best to answer your questions. Richard, that was, I'm enjoying this one on brains because we don't think about the brain much, do we? But it kind of matters.
No, it does, and I have to say that I've been looking out in newspapers and magazines for medical stuff that sort of catches my attention, and it hadn't really until this listener's question, and that caught my attention more than anything else I'd read recently in the papers. So absolutely, please encourage your listeners to keep sending them in, and if I can answer them there and then, marvelous. And if I can't, great. A little bit of homework for me.
Every day's a learning day. Richard, thank you.
Thanks, Andy.